Hi, my name is Sarah Leonard. I'm a student here at the College of Nursing, and today I'm going to be doing a medication administration checkoff. So first, I'm going to show my surroundings. Okay, I'm going to show my badge. And then now I'm going to compare my MAR to my order form. So first, on my MAR, it says my patient is Jaguar J. Jones. Jaguar J. Jones, date of birth, 8/25/1963, 8/25/1963. The MR is 417-6352, 417-6352. And then during this, I would be in a distraction-free zone. I would not answer any phone calls. I would limit my conversation with my colleagues to only essential things about this patient. And this is also my first check of accuracy. So now I'm going to check the medication we'll be using today. So it says heparin, 5,000 units, subcutaneously, every 12 hours, Okay, so now I'm done with my patient care order form. So now I'm going to perform hand hygiene, and I'm going to go into the med room. I'm going to keep the door closed. So I'm going to first check my medication. So it says heparin, 10,000 units per milliliter. The expiration is 12/5/2025, so it's not expired. So I'm gonna do my second check of accuracy and check the medication to the MAR. Heparin says 10,000 units per milliliter, and we need 5,000 units. So I'm going to be injecting half a milliliter, and the expiration date is 12/5/2025, so it's not expired, so we're good. And then I will also be using my TB syringe today. So now I'm going to take one of my alcohol prep pads. I'm going to open it up. And then I'm going to wipe from the middle out on my vial. And then I'm going to put it down. Open my TB syringe. I'm going to take off the cap. And I'm going to aspirate to half a milliliter. I just have to fill this with air before I withdraw my fluid. So half a milliliter. Okay. And now I'm going to insert it into my vial. Aspirate the medication. Now I'm going to withdraw half a milliliter. Okay, and I would also have another nurse check my math to double check that I'm giving the patient the right amount. Half a milliliter. Okay, and now I'm going to label my syringe. So on this label, I'm going to write Jaguar J. Jones, his date of birth, and the amount we are giving him today. So, Jaguar J. Jones. His date of birth is 8/25/1963, and we are giving him 0.5 milliliters. Okay. I'm going to wrap this around my syringe. And then now I'm going to do my second check of accuracy before I go to the bedside. I'm going to double check I have the right patient. Jaguar J. Jones, date of birth, 8/25/1963, 8/25/1963, and we're giving 0.5 milliliters, and it calls for 5,000 units, and the vial is 10,000 units per milliliter. And then now I'm going to go into my patient's room and give him this medication. Hi, Mr. Jones. Today I'm going to be giving you a heparin injection. I'm going to compare this is my third check of accuracy. I'm going to take my MAR and compare it to the wristband. So, Jaguar J. Jones, date of birth, 8/25/1963, 8/25/1963. The MR, 417-6352, 417-6352. And I see he has allergy to penicillin, Is there any other allergies I need to know about today? Okay, so now I'm going to perform hand hygiene. And then I'm going to put on gloves and goggles. Okay, so now, before I would give this injection, I would raise the bed to working height, lower the side rail, and I would also position my patient for comfort. And this is a subcutaneous injection, so this is going in the abdomen. It is going to be below the costal margins and above the pubis. I'm going to make sure not to hit the interior superior iliac crest, and it's like a U on the abdomen. So now I'm going to take my alcohol prep pad, and I'm going to open this up. And I'm going to examine the skin for any bumps or lesions or bruises. I don't want to inject where there's already an issue. So I'm going to start from the inside outwards and wipe down my injection site. And then now I'm going to double check before I give him his injection. Jaguar J. Jones, 8/25/1963, 8/25/1963, and we are giving him 0.5 milliliters. So this is going to be inserted at a 90-degree angle. So I'm going to remove my safety. I'm going to pinch up the skin, and I'm going to insert, and I'm going to inject slowly. Okay, and that goes in my sharps container. And then now I'm going to apply pressure. Okay, and now I'm going to go to the nurse's station, and I'm going to document what I did today. I'm going to reposition my patient for comfort, raise the side rail, lower the bed, and then I'm going to be back to check on you, Mr. Jones, and see if there's any issues with your heparin today. And that is the end of my medication administration checkoff.